So our webinar today is all about sleep and workplace health and wellbeing, a hugely critical area. And I'm so keen to hear now from the panelists and then from you, the audience, later in the Q&A. So first, let me introduce Associate Professor Amy Reynolds. And Amy is a clinical epidemiologist and psychologist based at Flinders University in Adelaide with 15 years of expertise in sleep research. She's the current program lead for the Shift Work Clinic there, a tailored multidisciplinary sleep assessment and management service designed for Australian shift workers. Her work is funded through an Australian Research Council Discovery Early Career Researcher Award, exploring the relationship between shift work, sleep disorders, and safety in the Australian workforce. So, Amy, welcome. And in the next few minutes, can you tell us what the research says in a nutshell about sleep and workplace health and wellbeing? And I'll also get you to very briefly in the next few minutes provide a brief summary of the annual Aussie Sleep Snapshot survey that you have helped us with and in fact led the most aspects of that. And that's been released this week. So over to you, Amy, to tell us about a few things before we get started.
Thanks, Moira. So look, I think, anybody that chooses to come to a workplace health and sleep session is probably pretty aware that when it comes to the workplace, our sleep and the sleep of the people around us can have a pretty big impact. And it's a bit of a broad spectrum impact. Many of us will talk about having the occasional poor night of sleep, and noticing the impact the next day, which can be pretty normal when we've got lots going on in busy lives. And on the other end of the spectrum are those clinical sleep disorders, those things like insomnia or sleep apnea, and some of the lesser known sleep disorders that can really impact how we're feeling and how we're interacting with the people around us at work, on a much more chronic level, many of which actually go undiagnosed and unmanaged for long periods of time. So in terms of how sleep impacts workplace health and well-being or even workplace safety, it really is a bit of a two-way street as well. If we're regularly not getting enough sleep or we're getting regular poor quality sleep, how we feel when we turn up to work, and indeed how we might interact with the people around us, how we manage our everyday roles can be impacted. And then when we look at those sleep disorders, Moira, we certainly see there's quite a significant loss of productivity. Doesn't always look like people not coming to work, though. A lot of the time when people are juggling poor sleep on a really frequent basis, it looks like presenteeism, which is coming to work and just not performing at the best that you possibly could. More broadly, the other considerations are safety. So if we're regularly not getting enough sleep, so getting really short sleep on a regular basis, or our sleep is really severely impacted maybe by some breathing stoppages during the night because of sleep apnea, how we are on the road, on the commute to and from work, but also some of the decisions that we make either behind the wheel if you're in transport, or even just your day-to-day jobs where near misses or accidents become really important. Tell us that it's really important that we think about sleep in the workplace, because we know that by middle age, it's about 43% of Australian workers are living with a sleep disorder. It's not just a bad night's sleep, a problem that, that might need to do something about. That starts early. So our young workers, our new graduates or our new trainees that are coming out into the workplace, it's a 1 in 5. Have probably got something going on, but very few get help. So sleep touches on everybody, whether it's because you've got disrupted sleep due to a new baby, or you're navigating, caring responsibilities for parents or other family members that might be aging, or your job requires you to be up at, hours of the day where you'd really like to be sleeping, or your body would like to be sleeping. There's lots of different aspects of work that impact our sleep, and also vice versa. And that's what we saw in the survey, was that more than one in 3 Australians feel like some of those work factors are impacting their sleep on the nights where they're not sleeping well.
That's huge. Thanks. So we're so grateful to have you, Amy. And I think we can unpack more of the results of the sleep survey as we go. And I think it's really important that we're having this broad lens of the workplace issues, and not just those individual issues of people's own, caffeine levels or their own meditation, and those sorts of things are hugely important. But these systemic workplace issues are really important too. So With that, it's a great honour now to introduce Daniel Allen. We'll call him Dan. So welcome, Dan. Dan is the co-founder of TradeMutt and TIACS, two purpose-driven organisations working to improve mental health outcomes for Australia's blue-collar community. A carpenter by trade, Dan co-founded TradeMutt to start everyday conversations around mental health through bold conversations starting workwear. From there, he co-founded TIACS, a professional counselling service providing accessible support to tradies, truckies, farmers, and blue-collar workers, all for free. So Dan, welcome. And in just a few minutes, can you tell us all a bit about TradeMutt and TIACS?
Yeah, no worries. Thanks, Moira. And g'day, everyone. Thanks so much for having me. This has been, I've been introduced already. Dan Allen, a carpenter by trade, 12 years on the tools. I've ended up here today talking about sleep and mental health instead of swinging a hammer full time. So, my professional journey has taken a few interesting twists and turns, but it's been an incredible ride and awesome to be representing the organisations that have co-founded here today. So, you mentioned TradeMutt, a social enterprise workwear company. We make incredibly loud, funky, high-vis conversation-starting work shirts for tradies, truckies, farmers, and blue-collar workers with a simple idea. Loud prints are designed to open up conversations and create deeper connection on site amongst colleagues, mates, family, or someone that you bump into at the coffee shop. It came about after losing one of my best mates who took his own life in 2015, but we managed to sort of turn a tragic experience and put a bit of a positive, approachable spin on an otherwise dark conversation. So, you also mentioned TIACS off the back of TradeMutt and TradeMutt's growth. We saw a need to really increase our work and further that work by creating a professional, accessible support service directly targeted towards Aussie blue-collar workers. So TIACS is the home of blue-collar counselling. As you mentioned, it's free, professional, built specifically for that blue-collar cohort and their loved ones. No cost, no wait list, and no need to even sort of know what to say. Our professional counsellors are there to help guide anyone through that conversation. The two organisations together are designed to increase help-seeking behaviour generally among the blue-collar workforce of Australia, something that, being a male-dominated workforce, hasn't been the best industry or workforce at reaching out for help. We like to think that we're playing our part in driving a much-needed social and cultural shift. I guess the reason that I'm on this call today is not because I'm a sleep expert, but I have 12 years experience on the tools, knowing what it's like to come home every day with that throwaway line, "I'm buggered." Something that often we wear as a badge of honour, but being continually buggered can sort of creep up on us over time and rear its ugly head in unexpected ways. So it's probably a really good through line for this conversation. Sleep is such an important part of our lives. And, it shows up on site in a whole bunch of different ways, in our moods, the way we present ourselves, our ability to focus and stay on task, and working in high-risk environments. Safety is such a big thing as well. So when you're off your game, it increases your risk of an accident, exponentially. So there's a strong through line there for, the conversation today. So it's a pleasure to be here, and hopefully I can add a bit of value.
Sure can, Dan. Yeah, thank you so much. What a wonderful introduction. And you can see with both our panelists that bringing such important different lenses. And I think the Sleep Health Foundation is really well placed to be at the centre of the ecosystem of, bringing together workers, research, clinicians, the general public, and all of us having a big collective voice around how we're going to shift the dial to get people sleep better, and all the various voices too. So we've got research, we've got trials, we've got all that sort of stuff, but getting it out to the hands of the people where it's needed the most, and people like Dan speaking the language and encouraging people to help improve their help seeking is going to be so important. So I'm excited. I think the audience would be really interested too. So I'll kick into quite a few questions that I have, and based on people who do shift work, people who live with sleep disorders, people who live with poor mental health have helped us shape these questions. And as I said to you, I've got a few questions for both Amy and Dan, but you as the audience feel free to actually get engaged as well with the Q&A function soonish, in about maybe less than 20 minutes now. So I'll start with you, Amy. So I mean, you sort of touched on this really, and it's a really big question here. But why should organisations treat sleep as a core pillar of workplace health and well-being, not just a personal issue?
I I think it's a really important question, Moira, and it's actually the kind of the positive next step. Often we hear about the negatives related to sleep or not getting enough sleep, and that's really important in terms of raising awareness and getting the right message about sleep to the right people or the most impacted people. Because the messaging we give about sleep differs depending on what's going on for an individual. But when it comes to the workplace, we want our workers to come to work and feel like they can be their best and interact their best and be their safest and get home to their families. So, I think the importance of organizations coming into this conversation is getting more and more visible. And that's because, if we want productive, happy workforces, we need to think about what happens outside of work too. And part of that is because we know that relationship between work and sleep is actually bidirectional. So if we're working to make sure that our workers are getting the sleep that they need, then coming to work becomes something that's less impacted by those negatives, those not, feeling like they're awake at 3 o'clock in the morning and not able to turn off the brain, or, revisiting something negative or traumatic that might have happened at work, or just simply trying to work against their own natural biology that says, I like to sleep later at night, but I have to get up for a morning shift. So, I think there's a safety element. And I think Dan touched on that so well in the sense of, certain workplaces have very important safety critical components, and we need to make sure that those workers are able to come to work fit for work. And that shared responsibility between the employer and the employee is so important in that. But it's actually so much bigger than that, because all of the things that we see in the literature are poor sleep impacts the way we interact. It impacts the way we handle stressful situations. It impacts the kind of colleague that we are, and maybe the colleague we'd like to be. So it's, it can be much harder to measure some of those aspects, not impossible, but, less visible maybe. And I think that's where we've seen a lot of the focus on safety in particular, and on which it should be, but also on productivity. And more we're now actually recognizing, well, look, there are those impacts on mental health too. Mental health in the workplace is getting the attention that it really deserves now, more and more. And sleep, we know that, addressing some of the sleep problems we see can actually have a knock-on effect for mental health too, because there is that two-way street when it comes to sleep and mental health. So look, I think ultimately workplaces need to be involved and should be prioritizing sleep, because it is something positive we can do something about for our workforce, but also because it ensures that we're providing an environment that, that workers actually want to engage in, retaining the workforce, supporting the workforce, and ensuring that people are safe.
Yeah, absolutely. And Dan, what are the most common sleep challenges that you hear within your networks affecting Australian workers, especially the blue collar workers and the farmers that you're talking with? Tell me about the common sleep. What are they telling you about their sleep?
Yeah, so look, I think it's good to sort of, firstly, talk about the difference between, I suppose, what the data is telling us and then some of that anecdotal feedback that we hear on site. And so, yeah, just again, want to flag the fact that I'm not here in a professional sleep, expert capacity, but, very much well connected with the reality of trading in blue collar culture. It was interesting to read through the findings from the survey, noting that work-related stress and job demands is at the top of the list in every single age bracket. Number one and number two factors across the board. That aligns with the data that we're seeing through TIACS. It is the number two presenting symptom or reason why anyone is reaching out, is that, work stress and job stress. Not necessarily just from, the stress of the job, but also, stress relating to uncertain future employment with a lot of tradies, blue collar workers working from job to job. So no doubt increasing anxiety levels, which of course impacts sleep. Interesting to see shift work sitting in the top 3 disruptors for nearly every age group. So that's obviously a structural problem, not so much a discipline problem. And the other one was with 1 in 3 workers saying that a work factor is impacting their sleep on the nights they don't sleep well. It's no surprise to me. I know the feeling myself, being a dual business owner and with my time on the tools. I know very well the difference between sort of being awake at 3 a.m., with, stress and anxiety, feelings. I also know the feeling different to that of being awake at 3 a.m. with excitement about something big that's happening the next day, but less anxiety and stress. And I also, know the feeling of a great night's sleep as well. I think it would be remiss of us to not mention the reality of lifestyle factors that absolutely impact our sleep. Substance abuse, anecdotally for mine, is something that needs to be spoken about more. It's very prevalent in all industries. I know it's very prevalent in trades and blue collar industries. Absolutely, whether it's alcohol as a coping mechanism or other drugs and substances.
Do you put caffeine in that, Dan?
Caffeine should absolutely be in there. My good mate, caffeine, yes. Absolutely. But I don't think some of these factors are being spoken about nearly enough. I think they're very much in, secret, sort of off to the side there. So I think it's a very real reality of our industry. That's not to tar everyone with the same brush and say that there's, industry-wide, substance abuse issues, but it is something that exists for sure. So, I think there's a bit to talk about there.
Yeah. Can I interrupt with the tradies and farmers and probably a lot of people we're talking about here? It's very crack of dawn, kind of up before the first light kind of work, and also a lot of young people who are just trying to still, have their life and socialize and have all other responsibilities. Can you comment a bit on the intersection there of just, just anecdotally, like what people are telling you, what you're seeing? How much is it a factor of just the early starts? Is that a huge factor, or what would you say?
Yeah, I mean, I think that the fact that, as tradies, we really can, there's definitely shift work that, happens within different trade environments, but the reality is, for the most part, is that we can only make hay literally while the sun shines. So yeah, it's those waking hours, sunrise to sunset, where we can actually be productive. And as you mentioned, we've all got lives to live outside of work as well. Probably young people don't really, feel the need to acknowledge, their sleep behaviors or patterns as much as, once you start to reach middle age, because you're young and invincible and you're an apprentice and you rock up to site, early, and maybe you can run on not that many hours sleep, but you also want to keep up your social life, and, you're out, till all hours doing God knows what. And then, that alarm goes off at probably 4:30, 5 a.m. and you're back at it. So no doubt the early starts have a big impact. But continual long days and fatigue really stacks up over time.
Yeah, it's just great. It's fascinating that, someone like me who's been in the sleep world for, 30 years or so. It's wonderful for us to be acknowledging it at all levels now, and particularly in workplace policy as well, that it's acknowledged that, psychosocial risk like safety and like fatigue is not just about be a bit tired, count some sheep and pull yourself together, get some more sleep. Recognizing that it can be difficult, but it is also modifiable. So back to Amy, I think on that note, what responsibility do employers have in supporting good sleep versus leaving it to just sort of an individual thing? What's your views on that? And what's the data tell us, Amy?
Yeah, look, I think ultimately it does differ a little bit by sector or by work schedules that are in play, or how long the work schedules are. So there are requirements, certainly for certain scheduling, that, employers do have to comply with. We probably can't go through all of them in the webinar with the time we've got. But I think the take home is that, there is a responsibility to make sure that workers get enough rest between their shifts, that they've actually got time to sleep And that's not just saying, well, there's this amount of time, go for it. There has to be time to get home. There has to be time to manage those other lifestyle factors as well. Trying to eat well, trying to move a little bit. Yes, sometimes there can be some quick turnarounds, but in a best practice world, there needs to be time. It's not enough to say it's your responsibility to get enough sleep. We do have an individual responsibility, but that's really hard to do if your schedule doesn't actually make the time to do it. And there's so many different factors when it comes to work that are impacting, like you said, Moira, on fatigue. It's not just a function of shift work or just a function of the type of job that you do. It's how long you're working. Dan, you make that point, sunrise to sunset. That's a pretty long day, especially during summer. That takes a toll on your body. You've been outside potentially in the heat. There's a whole lot of things that contribute to that fatigue. So I think certainly with some of the changes that you alluded to earlier, Moira, there is an increased responsibility to actually stop and go, hey, what do we need to be doing for our workforce? And, if they're not okay with their sleep, I think it will be great to see some organizations taking that extra step and saying, how do we go beyond, start with education, start with awareness, and how do we go beyond when there might be something else that our workers need to?
Do we know? I know you and the Flinders group and others around the world have been really concentrating a lot on the workplace and shift work. And do we know that improving sleep can realistically drive those measurable business outcomes, such as increased productivity, reduced presenteeism, reduced absenteeism?
Yeah, there's some really good evidence that that is the case. I think we're seeing that there is a need for more in that space, and certainly so that organizations can have that conversation with their boards or more senior sort of decision makers in terms of, look, what does it actually look like if we improve this? How do we raise the profile? But when we see, and certainly I think actually one of the bottom lines is if there's a safety risk related to not getting enough sleep, then that's the imperative to act. There needs to be action. And certainly some industries do have requirements to do that more formally anyway, depending on the industry. But more broadly, I think there's also a really unique opportunity now to shift from sort of separating that's at home time and this is your work time, and actually saying, well, maybe we are the workplace that goes that little bit further and looks at what we can do, to support sleep and mental health more broadly, to come back to Dan's point, because sleep is a modifiable factor, in a large number of instances. There's not just a benefit for productivity. Obviously, that's important for organizational context, but there's also a measurable improvement in mental health. And, that's a really important point and an important target for our workplaces.
Absolutely. Yeah. And back to you, Dan. It's really practical work that you're doing and really trying to make it more accessible. So what are the practical ways that workplaces can reduce stigma around both sleeping difficulties, and mental health difficulties? Tell me your thoughts on that.
Yeah, it's a great question. For mine, in every instance, whether it's sleep or, whether it's, conversations about, mental health and well-being, or just sort of being a little bit more vulnerable and open generally, it really starts from the top. So I think it's leading by example as leaders in workplaces to talk about, talk openly about, I suppose, our own sleep patterns, issues, processes or successes, different stresses that we've got going on, sort of more regularly, in a constructive way. So there's not just a once a year toolbox talk, tick the box and be done with it. It really is just sort of striking that balance of, embedding that openness and, vulnerability around a conversation that is so important more regularly without forcing it down people's throats. And, it's a very fine balance, I think, particularly in blue collar industries for sure. Sleep is also something that it's a very private thing, right? And so, much like mental health, what you may be going through, it's not seen. It's not necessarily seen by, people at work. So when you rock up at work and you might have had not a great night's sleep, it's almost harder to justify the impacts or the feelings that has on you, as opposed to, say, having a broken leg, a bad back, or something like that. And it's like, well, you're here now, so let's get into it. but also peer-to-peer channels. I think, open communication between our colleagues, tips and tricks, opening up conversations about what other people do. I think we're fortunate to have a lot of self-help content at readily available at fingertips. Not some better than others, but there's a lot of information out there around healthy habits and lifestyle habits. Even just winding down of a night time and the importance of that in preparation for sleep. So yeah, more conversations.
Yeah, absolutely. And I suppose there is a balance, isn't there, of just not being preachy and pushing it down their throats, but also highlighting that there are inherent dangers, especially for long-term health. And we at Sleep Health Nation are really conscious of we're wanting to state the importance of sleep. And we know there's really clear data about the relationships with mental health and other chronic conditions. But you also don't want to increase anxiety, because once people are sort of getting too worried about their sleep or too rigid, then it's, it can upset the apple cart for some people too. So I think it's really important that it's meeting people where they're at. And I think that the peer-to-peer is really, really particularly important in what you're doing, Dan. So hats off to you. And I think that that leadership too of starting from the top is point well made then. And so Amy, I think we're kind of going to get through another couple of questions each for you. Just I suppose I can just summarize really your last two questions I had for you, Amy, was should organizations with shift workers, as opposed to being employers in general, should they be doing something differently to minimize sleep disruption? And maybe part of the same question is, what should workers know, or how do they recognize when sleep's serious enough to go to get professional help? Because how do we really know at that point, whether it's just, oh, this is all part and parcel of just being a grown-up now, or being a worker and particularly being a shift worker?
I actually think that's a really tricky question to answer at a large scale level. And I think that comes back 100% to some of the things Dan was saying about peer-to-peer and how people talk to each other, is that, the answer to that question can differ depending on whether someone's just not getting themselves enough opportunity to sleep. So they're just not making enough time in the day to get to sleep, but sleeping okay when they are in bed, versus if they are trying everything in the toolkit, everything they've read online, and making all of the time and just cannot sleep. So more aligning with some of that, that insomnia, and a more, something that might align with the diagnosis. And like you said, that can actually be really important to get right when it comes to educating people, because otherwise, there can be a bit of a doom and gloom message about sleep and a lot of fear and uncertainty and worry. And for some contexts, yes, that's important. So if someone is really not sleeping enough and they are falling asleep at the wheel and they are a risk on a work site, or they're a risk behind the wheel, then that safety message needs to get through to that person. But on the flip side, when you've got someone that's trying everything and has insomnia, where the more they worry about it and the more they get anxious about it and the more of those messages they're taking in from the mainstream media, that's actually sometimes making the problem worse. So in terms of the messaging, I think and what organizations can do, or what they should potentially do differently, I think it's actually starting to, educate about the different types of sleep loss, so not just providing, advice about sleep hygiene, not just making recommendation about a good night's sleep, but actually helping people to know how they can plug into resources to find out more about their sleep, so that that individual can walk away and ask a few more questions. I also think that having, and I love that you made the point about leadership in sleep, Dan, because it's something that is absolutely critical. And we often talk to more senior workers and say, what can you do, and go out there and sort of take away that normalization of near misses, or, oh, everybody's tired at this point in the shift, or I felt myself doze off and had that moment when I've had a near miss. Sometimes that's normalized, and we don't want that to be normalized. We want that to be a trigger point of, having the conversation. Did you make enough time for sleep? If it's that they're squeezing too much into the 24-hour day, then that conversation might need to look a bit different to someone that then says, I try everything, everything I can, and I just can't get enough. And that prompt to, check in with some healthcare professionals. But more broadly, Moira, I think if you're having trouble sleeping 3 or more nights a week, or you're sleeping on the other end of the spectrum, you feel like you're sleeping every hour you possibly can squeeze in and you're still waking up not feeling rested, then there is a really simple message that, that's something to get checked out. It never hurts to ask the question. And one of the things that, obviously we're biased, we're in the sleep space. It's important to us, but if your sleep is kind of persistently not feeling like it's doing enough for you, or you're just not getting enough of it and you're not sure why, then, making your sleep part of a conversation about chronic health, about mental health, about your interactions with a GP or any sort of, other allied health providers as well becomes, it should become a little bit more routine, I think, because even it might be that you need some reassurance, or it might need, some more clarity around how to make a bit more time in the day to focus on sleep. Unfortunately, it's the lifestyle behavior you can't do while doing other things. You can't multitask sleep, which makes it a bit trickier. But making sure that we're getting the right messages to the people that need them, rather than trying to have just one singular message about sleep. It's all well and good to say, go off and make sure you sleep on your time off, but there's often a lot more to it than that, and we need to be really mindful of that, I think.
Fantastic. Dan, well, I think Amy, I'm going to take that as we've got the final question for both of you, was really, if someone could change one habit to improve their sleep, what would you recommend? So maybe Amy, have you covered that already, or would you have a single one thing?
I think, and I know, and this is coming from a shift work. I work with shift workers mostly, but getting your sleep as regular as possible when you have control and some dim light before bed, before each of your sleep opportunities, would be the easy things that you can think about. Yes, shift workers are a little bit more irregular, so it's a bit trickier, but it is still possible to try and, make your sleep as consistent in certain periods of time as possible, and keep those lights dim for at least an hour before you're trying to go off to sleep.
Perfect. And Dan, if one change to one habit that people could do to improve their sleep, what would you recommend, Dan?
Look, the sensible part of me wants to say, the things that, we all hear, like, get your phone out of arm's reach, from the bed, because, it's a distraction that, is just so readily available. But I don't even do that. So I don't want to, sit here, you know, calling the pot calling the kettle black kind of thing. Also things like, protecting your sleep wind down routine. I think they're easy answers, just to say, oh, do this. But I think even higher level than that is acknowledging that sleep and sleep health is so important, for everyone, and that shows up in so many different ways. So acknowledging that is something really, really important, to our health and well-being and vitality is step number one. But second to that is really acknowledging the lifestyle factors that are impacting your sleep and being honest with yourself around that. I think if you can't sort of find that ability to be honest with yourself about the things that that you're doing that are impacting your sleep, well, then you're not going to be off to the best start.
Yeah, absolutely. So yeah, fantastic. That's just, yeah, I think acknowledging that it's such an important thing in the first instance, which, until recently, people just didn't really understand that. It was kind of like sleep was just a symptom of, and I'll sleep when I'm dead. Like, who cares really? And especially when you're young. So I think it's really important that, yeah, the leadership of both what you're doing, Amy, and your group, and Dan, and all the wonderful initiatives that you've got, in partnership with a national organisation like Sleep Health and Nation, trying to reach people, and the workplace is such an important part of that, our messaging. So we'll get to the Q&A. We've got 10 minutes left or so, which is great. Got a couple of questions there, and I'll read this out. As a partner, this is anonymous, one of the attendees. As a partner of a tradie, how can I support without nagging him to prioritize his sleep so that he can work at his best, and sort of also I would add, be at his best. So I suppose Dan, what do you think to that one? And then Amy, what do you think?
Yeah, look, I'm sure there's a range of challenges that the partners of tradies face. Particularly if there's family and kids involved and that sort of thing. I think Nat hit the nail on the head with how can I support without nagging. it really is very much a, lead a horse to water kind of thing. I think a gently approach of trying to create an environment where there's wind down routines. There's healthy sort of sleep habits that are promoted and sort of shut down times at night, without sort of forcing someone, you need to get more sleep, because we know that kind of has the opposite effect. It really is a very gently approach, I think, and just, continually over time in a positive way, reinforcing, the benefits collectively, not just for the individual, but the family unit as well together, and the relationship that, some better routines can produce.
Thanks, Dan. And Amy, what are your thoughts on that question?
I like that the word routine came in at the end there. And I think, the more that we tell somebody something that they might know, the harder it can actually be to shift the dial as well. So I think, maybe making it a plan that's not just about the individual as well. So, it's not just identifying a problem for them. It's saying, like, what can we all do? Especially, don't know who the other members of the household are, but, actually bringing everybody into the experience. So it's not just a nagging, like you say, at one person. It's actually thinking about how you can do it as a household. And, maybe it's, looking at some of the structural things in the household that you can change. What color are the lights that are on in the evening? Are they super bright overhead lights that, might be impacting sleep timing as well? Can you make a strategy to keep, different lighting in the house at a consistent time of day for everybody? So then it becomes a shared experience rather than just expecting or wanting change from one person. And I guess the flip side of it is, really kind of recognizing and noticing when there is more sleep and what you notice are some of the positives as well. So it's not just, going in there and saying this isn't working, you need to do more, you need to prioritize your sleep. It's saying these are the good things that happen in our life, or, what I notice about, our life when there is enough sleep. And that's a really important part of the conversation too. It's easy to focus on the negatives, or, trying to get things moving in the evening, getting everybody to bed and knowing the time is getting shorter, that sleep is there. But changing the environment as much as you can to promote sleep for everybody can be beneficial. And really coming back to some of that positive messaging about what you do notice as being an improvement, rather than being the negatives of what I notice is not a good thing when you're not getting enough sleep.
Absolutely. Fantastic. Thanks both. Another one from Tessa. Thank you very much for increasing the light, pun intended, on how sleep problems impact the workplace. Appreciate how Amy ups the responsibility on organisations without moving away from the individual responsibility. Love that Dan pushes the need for conversations about issues like drug and alcohol misuse in our blue-collar workforce. So thank you, everyone. So that's great. We'll take that as a comment, Tessa, as they say in the Q&As. So that's wonderful. Any comments? Would you like to respond, Dan or Amy, to Tessa? Briefly? Well, I think it's just a nice compliment to you both for this open conversation.
It's always nice to hear in these forums that anything that comes out of the mouth sort of cuts through. So always nice feedback. So thank you, Tessa.
And then just finally, because this is good. It's sort of got a few minutes left, 5 minutes left. So another anonymous attendee said it would be great to hear from you all in relation to what you've seen in terms of best practice at an employer sort of level. What are they doing that is turning the dial to the positive regarding sleep health? So I'll start with you, Amy, and then Dan, collect your thoughts on that one.
So, a variety of things, which is really exciting. So ranging from, bringing in expertise to provide education and to provide awareness of sleep more broadly, but also, more specifically about what people can look for and what supports there might be, all the way through to some employers actually facilitating access to sleep care and sort of putting, one of the examples I saw was, recently interstate was an employer had recognised the return on investment of supporting access to sleep disorder care for their workforce, and they were just doing it. And that was not an easy, that was a regional context that they described, and they just made it happen. So I think, I find, there's variations all the way along the spectrum for that. And, I think all of that is encouraging because it means we're moving from a position of it being an outside the workplace to everyone saying, hey, what can we actually do? What's within our capacity to offer to help our workforce? We also see some employers actually providing supported referrals to clinical services. And we certainly see a bit of that where they take away the ambiguity of how do I get in, and they say, look, here's a clinical service you can access. We'll cover the gap, or we'll cover the cost. And I think starting to see that is really exciting because it means we're at a point where people are saying, actually, I know that there's other things we can do for our workforce, and it's not just waiting until it's downstream and there's been a negative impact as well. So lots of things are happening, lots of things are shifting, and I think it's encouraging to see everything from the increasing education all the way through to actually supporting the workplace with access to the specialised sleep services that they need.
Fantastic. And Dan, any comments or thoughts on that?
Yeah, look, employee well-being is at the top of mind, at the forefront for any business owner. Particularly now in 2026. We've talked about productivity outcomes, which is a real great way to frame it for employers. But I think if we're not building strong connections and relationships with our teams and good pathways to support in our day-to-day and BAU operations, well, then we're probably not doing the best that we can. So for myself, I think it's really important to be maintaining regular touch points with all of our employees. Whether it's through regular one-on-ones, to be checking in, not just about performance at work, but life and lifestyle, any external factors going on at the moment that we should be aware of, because a good supportive workplace should be supporting well-being, not just at work, but holistically in life. And I think being a perceptive leader and understanding, being aware of when someone seems off, or not themselves, or maybe does seem a bit fatigued, and finding an appropriate time during the day to check in on them, find out, what's going on. I notice you're a bit off. Is everything okay? Often, maybe it is a not great night's sleep, but often there's something that sits behind that as well. A situation, perhaps might have come up that's, caused stress, anxiety. And I think being aware of that and providing an employee space to, to have that day or that sort of off couple of days while they're dealing with something sort of maybe a bit heavier, is just a great way to be a supportive leader.
Yeah. There's more questions, but I think we have to kind of, Monica, I'll make sure we get back to you. I just wanted to make sure we ended exactly on time and give you this final slide of sort of call to action. I'd love you to look, well, first of all, there's a QR code here for a post-webinar survey that we'd really love to get your feedback on how to keep improving what we offer. There's a TradeMutt website there, which is, I'd love you to, look at more what Dan and his colleagues are doing. Workplace-related sleep fact sheets from the Sleep Health Foundation, a whole range of things, ranging from emergency workers to shift workers to all sorts of workplace issues related to sleep. So I'd love you to have a look at that. And also the aged sleep health clinics where Amy is in Flinders University to think about what they're doing. And I think you make a referral, even telehealth if you're not in Adelaide. And I think there was a slide maybe for the maybe I'm making that up, for our sleep survey, the Aussie sleep snapshots. If not, that's okay. I'd love you to look at our sleep health week stuff we have on the Sleep Health Foundation website, and really draw your attention to the highlights of the Aussie sleep snapshot survey, which is an annual look at what household Australians are telling us about their sleep on a range of issues, including workplace. So on that note, I think I will really thank you all for coming. I really thank deep appreciation to Dan and to Amy for your expertise and your generosity of your time today. And yeah, everyone sleep well. Keep raising the flag of the importance of sleep and its relationship to our health, and bi-directionally. And keep supporting the Sleep Health Foundation too in all we're trying to do. So thanks everyone, and we'll call it, bring it to an end now. Thank you.
Sweet dreams. Thank you.
Sweet dreams, everyone.